Is American Heart Month, and we've been covering a number of topics dealing with heart health, heart disease. We're diving into another today with Jennifer Short, who is joining us from St. Mary's Medical Center. Jennifer, thank you so much for coming in. We appreciate your time.
Yes.
Thank you.
Very important topic. Now, you're a nurse practitioner for the structural heart program at the St. Mary's Regional Heart Institute. I want to make sure I got it all in there. And so talk to us about disease. What should we be looking for? And, you know, how can you all help folks?
There are two main structural heart diseases, and structural heart disease are diseases, they're defects or disorders that affect the inner structure of the heart. Some of these can be present at birth, some develop later in life, and the two most common are mitral valve regurgitation and aortic valve stenosis. So once these valves become diseased, they either leak or they become hardened, causing them not to function like they should. This can lead to heart failure, or if it goes untreated, it can lead to death. Now, some patients early in the disease won't have any symptoms at all, but later, as the disease progresses, they'll be short of breath when they do activities, they'll have chest pain, they may complain of fainting or passing out, fatigue, and sometimes a heart murmur can be present. Now, a heart murmur does not always indicate that there is structural heart disease. We do recommend, though, if patients have these symptoms, to seek medical treatment, because once they get early intervention and start management of this disease, that is pertinent, because once they progress too severe, the prognosis is very poor. In fact, structural heart disease carries a higher mortality rate than most cancers.
Really?
Wow.
Well, that's eye-opening.
So anything that seems out of the ordinary, don't just brush it off. Get checked out, it sounds like.
How do you detect this? What do you use? Do you use like an echo or something like that to be able to find this with someone?
Most providers will order an echo, which is simply just an ultrasound of the heart, simple to do, takes 30 minutes to an hour. Most structural heart conditions are treated either surgically, called a SAVR, or they'll go transcatheter, and that's known as a TAVR. With a surgical approach, they cut open the patient's chest and fix the valve that way. With the transcatheter approach, they actually will go in a vessel, an artery. Typically, they use the femoral artery in the leg, and they'll fix the valve that way. And most physicians, providers alike, will recommend that patients seek early treatment and prevention, including healthy diets, regular exercise, regular checkups, smoking cessation, and maintaining healthy, normal cholesterol and blood glucose levels.
Things we should all be doing anyway right now.
Correct.
Okay, well, we've got information on the screen. If people want to find out more about what you all can do, the treatment options for them, what is the best way for them to contact you?
Their provider, their healthcare provider, can call and make a referral to the Structural Heart Clinic at the Regional Heart Institute at St. Mary's, or the patient can call themselves and make an appointment. The number is 304-526-1645.
I think the good thing here is that, as you hear from Jennifer, if you get this diagnosis, there's hope, right? This isn't like something where, you know, I mean, obviously, if you catch it later, you know, things could be a little bit more difficult. But if you catch it early, there's hope. They can help you treat it.
Lots of options.
You live this long, healthy life, hopefully. So, Jennifer, thank you so much for joining us to talk about this and diving into that topic a little bit more and explaining to us about structural heart disease and some of those treatment options for people. We appreciate it.
Thank you.